Okay, let's kick things off with a really foundational question in nursing. What is the primary purpose of a nursing assessment? Is it A, administering scheduled medications, B, determining the patient's needs, C, providing emotional support to the family, or D, documenting vital signs in the chart? Think about it. What's the very first, most important piece of the puzzle?
And the correct answer is B, determining the patient's needs. This is so crucial because really the assessment is the bedrock for everything else you do. You're like a detective, gathering all the clues to figure out exactly what's going on. Things like giving meds or charting vitals, those all come after you've built this foundation. Without a good assessment, you're just guessing, and that's not something we can do in nursing.
All right, let's switch from the why to the what. A huge part of the job is knowing the lingo. So, what does the term hypoxemia actually refer to? Is it A, high blood pressure, B, decreased oxygen levels in the blood, C, a slow heart rate, or D, an elevated body temperature? Take a second to think.
The answer is B, decreased oxygen levels in the blood. And here's a fantastic trick for remembering these terms. Just break them down. Hypo means low. Ox is for oxygen, and emia refers to a condition in the blood. Put it all together, hypoxemia, low oxygen in the blood. See? Once you break it down like that, it's way easier to remember.
Okay, time for a scenario. Let's put this into practice. Your patient is having a hard time breathing. What is the absolute best initial position you should put them in? A, supine, which is flat on their back, B, prone, flat on their stomach, C, Fowler's position, or D, Trendelenburg. What's your first move going to be?
The right answer is C, Fowler's position. And you know, this really just comes down to simple physics. When you sit a patient up, gravity helps pull their diaphragm down. That gives the lungs way more room to expand, which makes every single breath a little bit easier. Just think about when you're out of breath. Your first instinct is to sit up, right? It's the exact same principle. Okay, this next one is huge. Let's talk patient safety. What is the single most important step you take when you're giving medication? A, documenting it right away. B, checking the patient's identity. C, explaining the side effects. Or D, making sure the medication isn't expired. They're all important, for sure, but which one is the absolute top priority?
And the correct answer is B, checking the patient's identity. Look, all the other steps are vital, don't get me wrong, but they mean absolutely nothing if you're giving the medicine to the wrong person. This one step, just confirming who they are, is your final safety check. It's the last line of defense against a really serious error, and it has to be right every single time. All right, let's switch gears to another critical assessment tool. I'm sure you've heard of this one, the Glasgow Coma Scale, or GCS. What exactly are we using this to assess? Is it A, a patient's pain level, B, their neurological function, C, their risk for falling, or D, their nutritional status?
And the answer is B, a patient's neurological function. What's so brilliant about the GCS is that it takes something that seems subjective, like consciousness, and turns it into a concrete number. It's a score based on 3 specific things: their eye response, their verbal response, and their motor response. That simple score gives the whole healthcare team a shared language to track if a patient is getting better or worse.
Okay, next up is a really hands-on assessment. When a nurse checks a patient's skin turgor, what are they actually trying to evaluate? Is it A, hydration status, B, oxygen saturation, C, circulatory function, or D, skin integrity?
The answer is A, hydration status. This is such a cool, simple physical check. When you're properly hydrated, your skin is elastic. It's like a rubber band that snaps right back. But when you're dehydrated, it loses that elasticity and kind of stays pinched up for a second. We call that tenting, and it's a super quick visual clue about what's happening inside the body.
All right, let's turn up the heat with an emergency situation. A fire breaks out in the hospital. What is the nurse's absolute first action? A, grab an extinguisher and fight the fire. B, start evacuating patients who can walk. C, activate the fire alarm. Or D, close all the doors and windows. What do you do first?
And the correct answer here is C. This is where you have to remember that acronym RACE. It stands for rescue, alarm, confine, and extinguish. Now, your first gut instinct might be to be a hero and fight the fire, but after you've rescued anyone in immediate danger, your next job is to pull that alarm. Why? Because you can't handle a fire alone. The alarm is what brings the cavalry.
Okay, next question. Let's think about patients who aren't able to move around very much. One of the most common complications they face is skin breakdown. What's the other name for this? Is it A, atrophy, B, contracture, C, deep vein thrombosis or DVT, or D, a pressure ulcer?
The answer is D, pressure ulcer. The mechanism here is actually pretty simple to understand. When there's constant pressure on one spot, especially over a bone like a hip or a heel, it literally squeezes the tiny blood vessels shut. That cuts off the oxygen and nutrients, and the tissue starts to die. This is exactly why turning and repositioning immobile patients is so incredibly important. Okay, let's shift from the science of nursing to the art of nursing. What is the main reason we use therapeutic communication with a patient? Is it A, just to gather data for their chart, B, to give them a diagnosis, C, to build trust and understanding, or D, to get our tasks done faster?
And the correct answer is C, to foster trust and understanding. This is just so vital. You can be the best nurse in the world with your technical skills, but if you can't build a real connection with your patient, your care just won't be as effective. Good communication creates a safe space, and that's where real healing begins. For our final question, let's bring it full circle, right back to terminology. Knowing the language is absolutely key. So, what is the medical term for the complete absence of urine output? Is it A, dysuria, B, polyuria, C, anuria, or D, oliguria?
And the answer is C, anuria. Once again, it all comes down to breaking the word apart. The prefix an means without. Uria refers to urine. So anuria literally means without urine. It's a perfect way to end because that's what so much of this is all about. Taking these complex situations and terms and breaking them down into simple, fundamental steps. If you can master the fundamentals, you're building the foundation for amazing patient care.